Your feeding history should cover the method of feeding, such as bottle or breastfeeding, as well as the frequency and volume of feeds. Assess if there are any difficulties feeding or concerns from the parents.
So how is Alfie feeding?
He's just breastfed.
Okay, just breastfed.
Yeah.
And is he latching on okay? The feedings are going all right?
Yeah, everything's fine. Yeah,
Okay.
no concerns at all.
Okay. And how often does he breastfeed each day?
It's about every 3 to 4 hours.
Every 3 to 4 hours. Okay.
During your history, consider the presenting complaint. Explore this and identify relevant symptoms and signs that will lead you to a diagnosis. Similar to taking a history from an adult, consider red flag symptoms, those that may indicate serious or life-threatening pathology, and ask the parent or child if these are present.
And have you noticed, is there any change to Alfie's wet nappies?
No, I change his nappy every few hours and they're always full.
Okay. And how about Alfie's poos? Have you noticed any difference there?
No, they're always the same.
Pediatric medication histories should identify any medications taken as well as any allergies. If the child is breastfeeding, identify if the mother is taking any medications.
And is Alfie currently being given any medications?
No, nothing.
No. And you yourself, are you taking any medication?
No, I don't, nothing.
Okay.
In the UK, there is a routine immunisation programme which all children should follow. Assess if the child is up to date with their immunisations, and if not, identify the reason why.
And Rebecca, is Alfie up to date with his immunisations?
Yes, so he had them at birth and he's just had his 8-week immunisations that I arranged through the doctor.
Good.
The current UK immunisation schedule is shown below. A paediatric-specific social history should identify who is present at home, including all siblings and parents. If the child is of school age, confirm whether they are attending. It may be relevant to identify any pets or smokers at home, especially if the child is presenting with respiratory symptoms.
Rebecca, besides Alfie, who do you live with?
There's my husband and I and Alfie, and we also have a dog.
And do you or your husband smoke?
No.
During the examination, you may be required to demonstrate an understanding of how to identify and protect vulnerable patients, including children. Social services are the body who safeguard and promote the welfare of children and adults. They can support and protect vulnerable individuals. In extreme cases, such as cases of abuse, they are able to remove children from parental care. During the exam, if you have any concerns relating to abuse or neglect, you can state to the examiner your desire to contact social services, as well as informing senior staff.
And since Alfie was born, has he had to go back to hospital?
No.
So he's not had any injuries?
No, nothing.
And if I might ask, are you known to social services?
No.
Injuries are common in children, however can sometimes be non-accidental. Whilst it is not uncommon for children to suffer injuries or have an unplanned hospital attendance, multiple attendances or injuries may indicate abuse. It is important to ask parents if they, their children, or anyone in their family is known to social services. Be open and non-judgmental. Highlight that this is a standard question asked to all parents.
And Rebecca, are you known to social services?
Why do you ask that question?
So it's a standard question, and we ask it to all parents and guardians at the practice. Really, it's just to ensure that we can give the best support to parents and children so that we know they can grow up healthy.
Okay. Well, when I was pregnant, I suffered with some depression.
Okay.
So I think social services were notified then. But it never went any further, and I've been fine, especially since I had him. So
Okay, thank you for telling me.